Hi, today we're going to be looking at clinical associates in South Africa. We're going to be looking at the salaries they earn, the background to the clinical associate program, and then compare the salaries of the clinical associate to nurses and doctors. I'm Manithan Ryan, a medical doctor with more than 20 years of experience in the healthcare industry. So let's go ahead now and look at clinical associates in South Africa. In 2004, the clinical associate program was introduced. A national task team looked at the clinical associate program and came up with the scope of work, the curriculum, how clinical associates were going to function in the healthcare system in South Africa. In 2008, the Walter Sisulu University took on the first cohort for the clinical associate program. And in 2011, we had the first clinical associates graduating in South Africa. Let's go ahead now and look at the components of the salary for the clinical associates. The salary is based on a level 7 notch. This is the non-OSD salary grading with the following additional benefits. You get housing of 16,780, medical aid between 16,872 to 64,668 depending on the number of dependents you have. You get a birthday bonus of 8.33% and pension contribution of 13%. There's no rural allowance or in-hospitable allowance for clinical associates. So a clinical associate salary is based on a level 7 on the non-OSD category, as I said. So on notch 1, your notch is 257,508 and your minimum total cost to employer, that is with your pension and birthday bonus, is 312,443. Your net salary after paying taxes and pension is 17,559 and your pay on the final notch is 303,339. So your minimum total cost to employer then being 368,051 and your net salary being 20,174 rands. So how does this compare to a nurse and medical doctor? Well, the number of years of study for a clinical associate is 3. There's no further community service or internship like the nurse who has a community service which forms part of the training. So that makes it 5 years. With the medical doctor, they will have to do community service and internship. So it makes it 9 years. As far as independence goes, the categorization for clinical associates, once they've completed, is supervised practice. Nurses also are free to practice, as well as doctors once they've completed their 5 to 9 years, meaning that they can take on a private practice as a nurse practitioner and the doctor go on to private practice as a medical practitioner. So what is the salary of a clinical associate? Once completed after 3 years, it's 312,443, whilst the nurse practitioner is 311,711. For medical doctors, it's 858,711 rands. So what are the opportunities for growth? For a clinical associate, quite limited. There's no further career pathing that has been agreed upon. They're still negotiating in government and the Department of Health with the HPCSA, so there's no clear-cut career path. You're still under supervised practice. If you study further, do a master's or a PhD, you do not become independent, as with the medical doctor and nurses. For medical doctors, the opportunity is quite high. You can take up a position as a subspecialist or take up a managerial position, take up a head of department position, salary being 2.8 million. For nurses, I would say it's a moderate to high opportunity of growth. There's opportunities to specialize, there's opportunities to get into education, there's opportunities to take on a managerial role, but your salary is not as high as compared to a doctor. Is the clinical associate program good to get into? I would say definitely yes. There are opportunities to grow further. It just requires leadership from the country, from the universities, from the deans, from the HPCSA to move on to a better career pathing. So what is the proposed career path? As a clinical associate, I would suggest there be 3 streams to be taken, one being the clinical associate production stream, the second being the specialist stream, and finally the education stream. So with the production stream, you can take on a senior or principal clinical associate post. With the specialist stream, you should first qualify, do a master's and a honors, join a resident program or a registrar program and study towards the 3 main problem areas in South Africa, that is maternal and child health and primary health care services. So with the primary healthcare service, you should be able to manage emergency medicine cases and primary healthcare. At a obstetrics level, you should specialize further so that you're able to do a cesarean section, do a delivery, manage the complications. At an anesthetic level, you can give a minor local anesthetics as well as spinal, as well as a general anesthetic for uncomplicated cases. So these are specialist streams that a clinical associate can take. And finally, we look at the education stream. At the education stream, once you've completed your master's, you can take on a lecturing position and become a lecturer grade 1 or lecturer grade 2, and then head of department, vice principal, or deputy head of the school, head of school once you've done your PhD. So I think these are aspects you can take on as a clinical associate. The other option is then to do a master's in public health and then go into the research field where there's lots of research opportunities working for NGOs and so forth. Thank you for joining me looking at the salaries of clinical associates in South Africa. If you like what you heard, press the like button. If you want to hear more content of this nature, press the subscribe button. And if you want to know about becoming a CEO or hospital manager in the public sector, click my video on the right. After you've done an MBA or an MPH, this could be an opportunity for you as a clinical associate. See you soon.